So quickly looking at another issue which would actually come up in menstruation. This is what is known as what? Metrorrhagia. Alright, Metrorrhagia. So what is Metrorrhagia? Metrorrhagia just simply have to do with abnormal uterine bleeding, so it occurs between regular menstrual period. So let me say your menstruation is supposed to start 5th of a month, but 2nd of a month you are bleeding. It's irregular, right? It will make you confused about your menstrual period. Now some women have these issues and they're just living quietly with it. Maybe they feel like it's just a normal. No, it's not normal. Okay, so it's often unpredictable and can range from what? Light bleeding, she's just bleeding small, to she's bleeding so much. You understand? So it makes it more both physical and emotional disruptive. Physical means a woman just went out, she's not sure that her menstruation is coming, she didn't wear pad, all of a sudden she's bleeding in public, right? So what is metrorrhagia? This is bleeding outside the expected menstrual cycle. May occur randomly or follow a pattern. Can be light or it can have a very heavy bleeding. So she's having headaches, mood swings, all of that. So common causes could be hormonal imbalance. So your polycystic ovarian syndrome, you have thyroid issues, you are going towards menstruation, you are stressed. Okay, gynecological issues like you have uterine fibroids, you have polyps, you have endometriosis, you have what? Adenomyosis, right? Infections. Right. There's some side effects of some drugs, right, like blood thinners. Those are drugs that are against blood coagulation, so it could just make you bleed. Pregnancy related, like ectopic pregnancy. So maybe your baby implanted in the wrong place. Cancer, cervical cancer, uterine cancer. So if you see a woman bleeding heavily outside menstruation, bro, there are a lot of things to dig out for. Okay, so symptoms to watch out for: bleeding between periods, pelvic pains or cramps, blood clot or mucus in discharge, fatigue or signs of anemia. Is she weak? Is she pale? All right. Her eyes, are they yellow? Are they white? Bleeding after intercourse. So diagnosis, they can do pelvic examination and pap smear, okay, ultrasound or MRI, hormones or thyroid test, endometrial biopsies just to rule out cancer, pregnancy test if applicable. So for treatment options, hormonal therapies, non-hormonal medications like tranexamic acid, non-steroidal anti-inflammatory drugs. These ones will just depend on what is making her bleed. Do you understand? If it is vaginitis, if it is cervicitis, I'm using all those drugs that are against inflammation. Okay, antibiotics if I'm dealing with infections, right? Sexually transmitted infections, I also tackle them like that. This is not a disease condition, it's a sign that something is underneath. The doctor has to dig for it. Okay, so surgery, like if it is polyps removal, if it is fibroids, they can treat it. All right, then iron supplements if I'm dealing with a patient that has actually lost a lot of blood. Okay, so it's anemic, I have to replace the iron that they have lost.